Hi, my name is Carren Martinez, and I have been asking people of the nursing community questions about the discourse. And I've taken James Paul G's Discourse Community's 5 elements. I've asked people who haven't talked about discourse communities what their generalization of these elements were, and surprisingly I've gotten more information than I have on the web about personal experiences and how they felt the community was like from their own standing. And so I asked them about saying, doing, being, valuing, and believing. I have gotten unique responses from each person of like how their standing is in the community. To a person who's an everyday guy, who's physically stronger, generally speaking, to help in ways that probably the majority of women couldn't help. And so with all these people, it has helped me figure out that the nursing community has changed and it will be changing. And technology-wise and worldwide, it's still the community I still want to join. In terms of saying, this includes notes, this includes like how they talk to people, because nurses have to speak to patients differently and they have to use certain words. I interviewed these 4 people to see what they believed saying was.
They have to talk truthfully to their patients all the time, because lying is a bad thing, and lying to a patient is not going to help them.
Usually female nurses are more supportive in what they say, like they're more joyful about it, so like the patients wouldn't get worried. But male nurses, usually they're more direct and they like to get to the point, so they're like more assertive about what the information they say to their patients.
I think a lot of nurses, in terms of saying, have positive communication. They're very respectful to their patients and try to be optimistic.
As far as communication with nurses, I believe that other than being polite, they should also take into account their culture and being relative to what they believe in. So, for instance, of course, talking to someone who's Asian and then a person who's white. I mean, I hate to say that, but there is a cultural difference in communication, and you have to understand that Asians, they're probably more collective. So you have to understand you can't use individualistic words like I. You would use words like we, but if you're going to talk to someone who's probably from America or whatever, it's okay to use those individual words that designate towards that certain person. So I think you should, when communicating, you should understand their cultural background. Of course, always be polite, but you should also be sincere about what you say as well.
In terms of doing, I've gotten unique responses of saying how they do it and what they do.
Usually male nurses, since they're more physically stronger than women, usually, they carry more equipment, heavy equipment that women usually can't carry, also carrying patients to bed, and the more physically demanding jobs. So my dad's a nurse and he works in a jail facility, so in a jail there could be complications with patients, and so they would need a more physically stronger person to control the situation if needed.
A lot of nurses read up on information, so they find it easier to help diagnose their patients. And they try to look at the current information and do medical advances as well.
In terms of being, I got a generalization from both a male and female aspect and from times of the past, times of present, and times of future.
They have to be cleaned all the time, because if they contaminated anything that needs to be sanitized, that's not gonna work, because they can spread germs to the patients, and the patient might get worse.
Before, I guess nurses, they had that whole World War II image, just the cute, sweet nurse. But now that in present day, we're all diverse. It's not just women, it's also men. Nurses can take any form now. It's it's everything. So there's not that whole stereotypical image of a female nurse anymore.
I think the way nurses are, they're always in scrubs, always have their hair out of their way, wearing tennis shoes, ponytails, and they just have this clean look to them.
In terms of valuing, each person gave me something that they valued and what they believed other nurses valued.
First, of course, they value their patients first, and they value their job. Like, you have to be professional to your job. You have to value your patients, because that's your job. You have to care for patients, and you have to do your job right.
I think a lot of nurses they value life as well as medicine and new medical technologies.
I think nurses value the overall well-being of the patient. I mean, it doesn't matter how long it takes to make sure the patient's okay, as long as they get there, and that's what nurses value. I mean, they also value affection, because I know a lot of patients, that's their time where they need as much help as possible, and they value like love and support.
In terms of believing, it was hard to think of it right off the spot for every person, but they all gave me something that they believed.
They believe in the healing process and to become better within the body.
I think the problem with doctors is they believe that their goal is to get the patient taken care of and healthy, but they try to do it in a task way where it's like, get this done, get this done, get this done, and do it as fast as possible. Whereas nurses, they want to get it done, but they want to get it done right, and it doesn't matter how long it takes, as long as they make it there with the right quality of health. So I think that's what nurses believe is quality as opposed to quantity, because as you can see, doctors are always like pulling patients through their office, just quick, but nurses, they'll take their time and they'll make sure they're okay.
Well, I think caring, because some doctors just, oh, this is what you need, this is blah, 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 this is what you have, this is your medication, this is your medication, get out of my door. 'Cause nurses care. Like, it's so different, I think. 'Cause that's why patients like nurses more than doctors.
Well, I just want to say that doing this project and doing this research has helped me figure out what I was getting into before I actually got into it, which I think has helped me. And I think it has helped me like this community so much more than I did in the beginning.